Opioids are analgesics, and their use often leads to high dependence and addiction. Currently, 40% of U.S. opioid overdoses involve a prescription opioid, and in 2016, 46 people died every day from these overdoses. Dentists prescribe 12% of these opioids. Thus, it is important that dentists have a clinically based set of solutions to minimize drug misuse and abuse. First, dentists should be required to use the prescription drug monitoring program every time they prescribe an opioid. This online record shows the prescribed drug history of a patient. This data may alert a dentist to a developing or established addiction in that patient. Secondly, dental students and professionals should be required to complete education courses on recognizing addiction, diagnosing true chronic pain, and dealing with the emotional and psychological issues which accompany dental pain. This could greatly increase the quality of patient care and reduce opioid misuse. Thirdly, prescription opioids should give way to safer alternatives. Research has shown that acetaminophen and ibuprofen are equal to codeine in reducing dental pain. Using ketorolac nasal spray to treat wisdom tooth extraction pain has been as effective as oxycodone, according to one study. As with any plan, there will be limitations. Enforcing the use of the online drug monitoring program may be difficult. An alternative would be to legally necessitate that opioids be prescribed through the state monitoring systems, so the dentist would have to comply with patient history screening. Although education can be easily mandated, the level of learning, retention, and compliance is highly variable. And because the use of strong pain meds is seen as the norm, it may be difficult to convince both dentists and patients that alternatives are equivocal. Nevertheless, we believe our proposals could be both effective and highly successful if approached correctly. The risk of failure is hardly greater than the possible success, and every effort should be made to encourage dentists to do their part in fighting the American opioid crisis.